Hi, are you having severe pain in the soles of the feet and which is especially more in the morning? And are you finding it very difficult to take your first step from the bed? Then most probably you are having plantar fasciitis. Plantar fasciitis usually increases during rainy season, but nothing to worry, there is a way out. Hi, I am Dr. Pradeep Kr, Shenoy, India's first DNB consultant rheumatologist, addressing you from Amrita Center for Rheumatoid Diseases in Mangalore. Plantar fascia is a thick web-like tissue which runs from heel bones to the base of the toes. It helps in weight bearing. It acts as a cushion while bearing the weight, and it helps in evenly distributing the body weight throughout the soles. It helps in maintaining the arches of the feet, and it helps the arches to bear the weight. It is located in front of the superficial muscles of the feet, and it is below the skin of the sole. Inflammation of the plantar fascia is called as plantar fasciitis. This can be seen in obesity, overweight, and in pregnancy. This also can be seen in endocrinological conditions like hypothyroidism and uncontrolled diabetes. This can be seen in seronegative spondyloarthropathies like reactive arthritis, ankylosing spondylitis, psoriatic arthritis, and enteropathic arthritis. So, before the monsoon, all these conditions has to be treated to have a successful outcome during monsoon. Now, let us see what happens during monsoon. In monsoon, there is a fall in the barometric pressure, which makes the tissue fluid to migrate from one compartment to other compartment. This can swell the tissues. Swollen tissue can compress upon the inflamed plantar fascia, and it can compress upon the sensitive nerve endings, can increase the pain of the plantar fasciitis. And subsequently, during rainy season, there can be a cool temperature and dampness. This can make the muscles taut. Muscles can tendon can become tight and taut. So, in the case of plantar fascia, when the calf muscles become tight and taut, it exerts a pulling tension on the tendo-achilles, which is transmitted to the plantar fascia, and subsequently it irritates the inflamed plantar fascia and increases symptoms of plantar fasciitis. Now, during rainy seasons, we usually change our footwears. We use flip-flop footwears, or we use waterproof footwears. The flip-flop footwears are really hard and they don't have support for the arches of the foot, so they produce more pain. And even if we use waterproof chappals, if there is no support for the arches, the plantar fasciitis can increase. The symptoms of plantar fasciitis can increase. Now, if the arches of the foot are supported, and if there is no way out for the water, if there is water logging, plantar fasciitis can become more symptomatic. So, nowadays, let go water footwears are freely available in the market, so one can purchase them. This is very effective. Other ways of dealing with it is do relaxation techniques for the calf muscles in the morning, as well as do relaxation techniques for tendo achilles, and do range of motion exercise for ankles. And please don't walk on the cold hard surface of the house without wearing the footwear. If you go out, the puddles in the street can introduce germ into the plantar fascia, and if there are cracks and cuts on the plantar fascia, it can be infected. So one should always inspect very carefully during the monsoon season for evidence of infection in the plantar fascia. So if you adopt all these measures, you can survive plantar fasciitis during monsoon season. And I will be back with more interesting topic in the next week. Do follow me. Thank you.